Hello, my name is Michael Hansen, and I am talking today about thumb sucking and some of the devastating consequences that come with that from a craniofacial and airway point of view, and as well as what we typically do to address it. As I mentioned, thumb sucking can have a pretty severe and devastating effect on the jaws, which then trickle back to have troubles with the joints and the airway and many other things. So I wanted to share a case with you about a 5-year-old child that we had intervened with who is still sucking his thumb at this point in the game. And you can see that it's created a good open bite and impaired his tongue function already, because his tongue's sticking through there as kind of a regular posture. When we look at his teeth themselves, we see a lot of information here that tells us about what the thumb is doing. We see this on the upper left-hand corner of the screen. We see this arch beginning to narrow in, and almost looks like it's conforming around the thumb itself. You can almost see a thumb imprint in there. And the teeth are tipping in. Things are just becoming small, and what's happening there is that the thumb is putting pressure in on the palate. The cheeks are pushing in on the sides with some pretty good force, and all the while the tongue has to sit below that thumb, so it rests low and creates a suckling motion in a forward and back direction that is counterproductive to the growth of the upper jaw and can help the lower jaw get a little bit bigger. So, we see as that happens, like I mentioned, the arch begins to narrow, the vault of the palate or the roof of the mouth starts to arch up, and as it arches up like that, remember the roof of the mouth is also the floor of the nose, so we see that bone starts to impinge into the nasal airway, makes things a little more difficult from a nasal airway perspective, often leads to mouth breathing. In his case, he's got an open bite, meaning that the upper teeth don't overlap the lower teeth like they're supposed to. They've kind of conformed and moved around that thumb, and probably what he's doing with his tongue when the thumb's not there, which just exacerbates the problem. And in his case, he's made a compensation as that becomes narrower and narrower up top and larger on the bottom. Quite often the child will compensate by shifting his jaw to one side or the other because it becomes easier to eat. The teeth are no longer, when they're end to end, it's hard to chew. You have to overlap a little bit to get good chewing function. So they will often shift their jaw, make a functional shift to one side or the other. In this particular case, he's moved to the right and developed a tongue thrust to go with it. I'll show you a little bit more what I mean by that. If we look at this, just this picture alone, we can see that the bottom teeth over here on the right are on the outside of the upper teeth. Well, it's just the opposite over here on the left. This is the way it should be. And a lot of people may look at this and say, oh, shoot, he's growing differentially because, one side is growing bigger than the other. But in this particular case, and in many cases, that's not what's happening. The jaw has just shifted. We can see that when we look at where that midline, the midpoint of the upper jaw is relative to the lower. It is definitely shifted to the patient right. And when we look at the the jaw joint itself, if we look at the left side or the right side, excuse me, it's the little hinge point of that jaw represented here. This is the ear canal, is kind of shoved up and high into the socket more than it should be. The one on the left is a little hard to see, but it's pulled down and out of the socket. And so the whole mandible is rotating and shifting to the patient right. Right now, it's just moved them out of socket a little bit. If that were left to continue growing like that for a long period of time, eventually the jaw makes a correction and you do get this unilateral growth and asymmetric growth of the mandible or lower jaw, which becomes very difficult to address later on. In this particular case, though, we measured the skull, take a good look at where the bones are, and develop a plan for him. We can see that it's had a pretty rough effect on the tongue itself. Quite often our thumb suckers will develop a very low tongue posture. So this is a profile x-ray. We're kind of looking at him from the side like this. Obviously his nose here, lips open. So, probably breathing through his mouth rather than through his nose, which is why this adenoid tissue is getting nice and big like that. Soft palate sitting here. This tongue should be sealed all the way up here. And so it's just a solid gray from here to here, but instead we see it sitting low. That can have a pretty tough effect on the airway itself. He's very restricted and showing some signs of some sleep disordered breathing issues that go along with that. Because as we we'll back up and look at this, as that upper jaw narrows in and the lower jaw shifts to the side, but it also shifts back. And as it's shifting back, that's where a lot of that restriction is coming from. And if we look at it without the bones in the way, we can just see from the side and from the front how restricted that is. So we develop a plan, place him in an appliance, and have him wear this, turn the gears to help the upper jaw get bigger, and work on that thumb habit. Of course, a thumb is a substitute for the suckling reflex, which stimulates some of the nerve tissue just behind the front teeth in a very sensitive nerve center there that when stimulated, can release endorphins, make you feel good, which is why the kids will do that. But obviously has a lot of pretty negative consequences. So the appliance covers that area so you can't get to it. This appliance is removable. And so this little turkey would, when nobody was looking, would take the appliance out and continue to suck his thumb. And if mom looked over, he'd pop it back in really quick. And so we ended up placing some tongue tamers on the front teeth so that when he did take it out, it was still difficult to suck the thumb. And that seemed to be what did the trick in this case. With about 6 months of semi-compliant therapy here and where, we were able to get him balanced again. And you can see that the midlines have corrected. So as we've expanded that upper jaw and made it big enough to house the lower jaw, it has self-corrected and lined up straight again with the upper jaw, so that now the joints are balanced again and the bite is closed, so it's easier to work on correcting the tongue thrust that had developed. and just really made a big impact on his life, being able to correct that at this point in the game rather than deal with it throughout the rest of his life. Certainly would have continued to have airway issues, joint problems, and all the things that come along with that. So again, midlines lined up, and ultimately a very good, successful correction there. So beware of thumb sucking, and if you do recognize it and can stop it early enough, sometimes the body can correct itself. But if it goes, later into life, like this child, some intervention, as we've illustrated here, sometimes is the best course of action to stave off some pretty big problems. So I thank you for tuning in and look forward to our next one.